So in the nursing home, one of the things that happens is that during the care planning process is to determine whether a particular resident or your family member is at a risk for suffering falls in a nursing home. So if they're a patient that regularly moves about, has full mobility or somewhat limited mobility, generally speaking, unless they have other conditions, they're not usually susceptible to falling. However, in the care planning process, there's a fall risk assessment process to determine whether a particular person is susceptible to falling in the nursing home, and then sometimes measures are put in place to prevent that from happening. Some can be what's called a gait belt. In other words, when someone's up, that they have what's called a one-person assist. In other words, someone in the nursing home is helping them, whether they're going to the bathroom or whether they're walking around the facility. That's put in place called a one-person assist. If they have more needs and they're more disabled from a walking perspective, they may have a two-person assist, meaning that there has to be two people there by the nursing home to help get that person out of bed and around the facility. So if your resident has been assessed as being a fall risk, there are several measures that can be put in place, including one- and two-person assist. So be very proactive in that process when that occurs.
Our goal here is to be champions for the injured.